This is a case of Miss Wells, a 28-year-old African American female who came in with chief complaint of shortness of breath and wheezing. History of present illness started when she believed she developed these symptoms following a near asthma attack that she had 2 days ago. At that time, she was at her cousin's house and she was exposed to cats that triggered the symptoms. She then developed the frequent attacks, which were a 6/10 severity, and her shortness of breath was a 8/10, lasting for about 5 minutes, occurring approximately 10 episodes of wheezes per day and shortness of breath every 4 hours. And then she awakens with nighttime shortness of breath twice per night. The symptoms were decreased but not resolved by using her albuterol inhaler. Her last episode of shortness of breath was this morning before coming to the clinic. Past medical, she was diagnosed with asthma at age 2.5 years. She has been hospitalized 5 times for asthma. The last one was at around age 16 years old. She has no recent use of spirometry. She does not use a peak flow. She does not record attacks and does not have a home nebulizer or vaporizer. She has never intubated for her asthma. She does not have a current pulmonologist or allergist. Her only medication is albuterol inhaler, PRN. Allergies. She is not aware of any environmental exposures or irritants at her job or home. Personal history. She denies current use of tobacco, alcohol, and illicit drugs. She did smoke marijuana for 5 or 6 years. Her last use was at age 21 years, and she does not exercise. She complains that her current symptoms are beginning to interfere with her daily activities, and she is concerned that her albuterol inhaler seems to be less effective than previous. The review of symptoms, she states that her breathing is normal. On physical exam, she's not in acute distress. She's alert and oriented, sitting upright on an exam table. She maintains eye contact throughout interview and examination. In the office, spirometry was forced vital capacity of 3.91 liters, FEV1 over FVC ratio of 80.56%, and SpO2 of 97%. The chest expansion is symmetrical with respirations, normal fremitus, symmetric bilaterally. Chest is resonant to percussion, no dullness. Bilateral expiratory wheezes in the posterior lower lobes, with bilateral muffled words with notable expiratory wheezes in the posterior lobes but no crackles. The diagnosis is severe persistent asthma. The treatment is Combivent inhaler, 2 puffs every 4 to 6 hours, PRN, and Symbicort 2 puffs twice a day. She can also be treated with prednisone 40 milligrams per day for 5 days.